to time. Thank you, Melise. And a huge thank you to everybody, our speakers and guests, for joining us today. My name's Helen Chatterjee. I'm from University College London, and I lead a programme called Mobilising Community Assets in partnership with the National Centre for Creative Health, where I'm also a trustee. And today we're going to be exploring the exciting topic of connecting roles across creative health. And you'll understand more about what those roles are after our presentations. We're really, really pleased to be joined today by two BSL interpreters. A very warm welcome to Sarah, hello to you, and to Paul, who will be tag team interpreting for us. So many thanks to you for joining us. And we've got two presentations today. The first presentation is from Alex and Jane from the National Centre for Creative Health. So we're going to first of all hear their presentation. Then we're going to move into a question and answer session. And if I could ask everybody to use the Q&A button, which you'll find at the bottom of your screens. And if you can pose your questions in Q&A, and you can do that at any time throughout the presentations, I will then read out those questions and pose it to our panelists once they've finished their presentations. So I hope that sounds okay. Please don't use the chat because we can't see that. We've only got our own chat. So the only way to communicate with us is via Q&A. And if you've got any questions, then that's the best place to post them within the Q&A function. After we've heard from our first presentation from NCCH and had their Q&A, we're then going to hear a presentation from Arts for Us. And you'll hear all about Arts for Us after NCCH. And then there'll be another Q&A session where you can pose questions to Arts for Us or NCCH. So I hope that sounds okay. We're really excited to hear from our speakers. So without further ado, I'm going to invite our first two speakers, Alex and Jane from the National Centre for Creative Health, to join us. And if you want to share your screen, I can hand over to you guys.
Thank you, Helen, and great to be here. I'm Alex Coulter, Director of the National Centre for Creative Health. So Jane, could you move us to the next slide? So the NCCH was formed in response to recommendation 1 in the All-Party Parliamentary Group on Arts, Health and Wellbeing's inquiry report, Creative Health, the Arts for Health and Wellbeing, published in 2017. It launched in March 2021, and our mission is to advance good practice and research, inform policy, and promote collaboration, helping to foster the conditions for creative health to be integral to health and care and wider systems. Building on relationships developed through the inquiry process, we delivered a Creative Health Hubs programme with 4 integrated care systems in England: Gloucestershire, Shropshire, Telford and Wrekin, Suffolk and North East Essex, and West Yorkshire, in partnership with NHS England. Out of this, we developed a Creative Health Toolkit with the aim to support other systems to embed creative health. With the support of Arts Council England, we then embarked on the Creative Health Associates programme, which enabled further progress on embedding creative health into planning in systems. 7 Creative Health Associates were employed by us and hosted by Integrated Care Boards, the NHS bit of Integrated Care Systems, 1 in each NHS region in England. The programme ran from July 2023 to March 2025 and was led by Jane Howard, our programme manager. I'll hand over to Jane to talk about the programme's challenges and successes and the findings of the evaluation.
Thank you, Alex, and hi everyone, I'm Jane Howard, the programme manager here. So just to talk you through what the programme aimed to do, the focus for the programme was really about building bridges in that connecting role between the culture and creative sector and the health and care sectors to sort of improve understanding of the role that the creative and culture sector can play in addressing health priorities, and also helping the creative and cultural sector understand what those health priorities are. It's really part of this process of trying to embed creative health into strategic planning. So our associates were looking at where were the opportunities to weave creative health into health strategies and plans, including things like workforce development, social prescribing, health inequality plans, and also highlighting and supporting local initiatives and partnerships. So we know there is plenty of work going on, but it's not necessarily seen within the health sector. So a lot of their work was around raising awareness of the work that was already happening in the sector. There's an illustration here on the one side of the slide of the sort of programme in numbers, the sorts of things that the associates did. So a figure that really jumps out is the connecting with over 1,500 new connections. So that's 1,500 conversations about creative health within the health and care sector that wouldn't otherwise have happened. And these connections included directors of public health, communications and public engagement leads, clinical leads, primary care network leads, sector leads in the voluntary and community sector, Health Watch, higher education. So a huge raft of connections that were made, of new connections that were made. And clearly, we don't know where all those conversations led. Some of them we can track, but what we can assume is that with that amount of conversations and those connections being made and those discussions happening, that there will be some ripple effect. There'll be more people knowing about creative health and its potential than there were before. They also had a number of events, over 60 knowledge sharing events, knowledge exchange events, bringing together health and care people with creative and cultural sector people. And also alongside that is 21 huddles. So huddles are interdisciplinary learning activities for small groups using co-production. They bring together people with lived experience, with creative practitioners and with health and care professionals to look at ways of improving systems and services. So it's an example of creative health approaches that can be used in the health and care sector. And they also developed some new resources and developed sort of links with higher education. Now, they were all in these 7 ICBs. All the ICBs are different in terms of their priorities, but there were some common themes, and these are the common themes that were that they all saw as priorities within the ICBs. So mental health, especially of children and young people, was a priority across the ICBs. Health inequalities, ICBs have a particular responsibility to address health inequalities. And this could be around looking at particular groups, so homeless people, refugees and asylum seekers, for example, people with protected characteristics, or it could be about inequalities between places and neighbourhoods within ICBs, where mortality, morbidity is very different within one ICB. So though health inequalities was a key issue for the ICBs. And then I've put workforce wellbeing there. I wouldn't say it was highlighted as a priority, but it was an underlying theme across all the ICBs. It was something they were all concerned about. And so it was an opportunity for creative health associates to think about how can creative health help to address the issues around workforce wellbeing. As you might imagine, it's quite a challenging role. These were new roles within the health service, and this was at a time, and it continues to be a time of great change within the NHS. So during the time of this programme, there was a restructuring and cost savings programme beginning in the ICBs that has continued, of course. This involved ICBs having to reduce the headcount, reduce the numbers of people working for them and making significant savings. And this led to some teams being completely disbanded, including social prescribing teams, personalised care teams in some ICBs, which were where our associates were originally hosted. So that did bring it challenges, of course. They're also working alongside staff who are in a great period of uncertainty. So the other challenge around that was the low staff morale. I think we've all heard about the ongoing impact of COVID on healthcare staff, and the continuing changes and uncertainty has been difficult. And if you can cast your mind back to sort of 18 months or so ago, we were in a sort of state of inertia, really waiting for an election that we knew was coming, but not quite sure when. And it meant that the NHS actually sort of was in itself a period of inertia. It was quite difficult for them to make decisions. They didn't know what the long-term plan looked like for the NHS. So that was quite challenging. I've mentioned health inequalities. This is a relatively new responsibility for integrated care boards, and I think it's fair to say that many were struggling with it. Having said that, it did provide an opportunity for associates to show how creative health can help to address those health inequalities. And I think in some areas, associates were concerned about the capacity and readiness of the creative and cultural sector to respond. So it's all very well raising awareness and raising the profile of creative health and hopefully stimulating demand for creative health programmes. But did we have the provision in some of those areas to be able to respond to that? Were people joined up enough? Did they have the appropriate training to do that? That wasn't the case in all areas, but in some it was a concern. So there were significant challenges in the programme. Nevertheless, I would say, given all of that, the programme landed really well within the health and care sector. It was very well received by integrated care boards, despite the challenges that they were experiencing. So some of the successes from the programme, they clearly raised awareness about the potential for creative health to address specific priorities. So things such as maternal mental health, respiratory disease, stroke rehabilitation. There have been some interesting discussions and some work beginning in those areas. This whole thing about connecting, facilitating networks and conversations across systems and sectors was absolutely key. A number of new networks were formed: Kent and Medway, Lancashire and South Cumbria, Directors of Public Health across the Midlands, and those have continued even though the associates are no longer in post. They catalysed sort of developments and programmes, particularly through the Huddles work, which demonstrated different approaches to service redesign and improvement. And we saw creative health featuring in a number of strategies and plans of the ICBs and ICSs, so things such as deprescribing strategies, waiting well plans, etc. And there were a number of new strategies developed during the time of the programme. And by the end of the programme, we were seeing an increased interest in and demand for creative health, which is what we wanted to see clearly. We commissioned an external evaluation of the programme. Beth Crossland and Gemma Buckland were the people that we commissioned to do this work, and they took a systems thinking approach to the evaluation of the programme. So systems thinking is really about, how do we understand change in complex systems? What is going on? So systems like healthcare, public health are complex systems. This was a model that was found to be really helpful and has landed really well within the sector, this two loops model, which is the model that they used. And the key idea here is that change is not linear, that old ideas sort of fade away and new ideas emerge and they overlap. And there is activity happening in all of these places. It's not a straightforward progression, linear progression. So just to explain this model a little bit, the top loop that you can see on it's on the left-hand side of my screen, it represents the incumbent system, the current system, the existing ways of working. And it shows that that system is gradually declining. It reached a peak, and then as contexts change, circumstances change, the system becomes less effective and less relevant. And so that system is in decline. And at the same time, we have new ways of working. This is the bottom loop that's beginning to emerge. New ways of working starting to grow. And as they gain strength, they merge with and then replace the old system, and we have a sort of new paradigm. And within that model, there are these various phases of transformational change. And these can be happening all at the same time. That's not necessarily, a linear progression. So we have the incumbent system, and one of the models within the incumbent system, one of the phases, is this phase of naming. So how do we start to put a name to the new ways of thinking and working? What are those things? What do they look like? What are they called? We have the connecting phase. How do we bring together those people, those early adopters, if you like, people who are seeing this, who are understanding these new ideas and excited about them, and we need to connect them up so that they can become stronger. We have the pockets of the future, which I really like, which is these examples of new practice emerging. So it might be small scale pilots. The Huddles are good examples of pockets of the future, of things that could be, and they might only be small scale at the moment, but they show promise and they show potential and they inspire people to think about change. In the sort of middle of this model, as the two models overlap, we have what we call hospicing, and in this model it's called decomposing. We called it composting in ours. So this is thinking about the old system. How do we take care of the old system and of the people working in that system? It's not just about sort of binning them off and saying, that's it, we don't value this anymore. How do we look after those people? And how do we use the useful practices, knowledge and experience from the old system into the new system? And that is really something that the associates were very thoughtful about in their role. And then we have this key phase of bridging, which is what this session is all about. The bridging was, how do we build bridges from the old system to the new system? How do we facilitate that transfer of knowledge and resources from the old to the new? And then as the new system starts to emerge, we need to be nourishing that system. What can we do to maintain that, to encourage that and support that growth? And then as it becomes the new paradigm, how do we strengthen that system? How do we illuminate the growing strength and power of that system? How do we showcase the successes to make the new system and ways the norm? So the key principles here, it's that systems change is non-linear, it's dynamic and iterative. It happens at many levels and at different times. It can be about individuals, teams, organisations and systems as a whole. It's very much test and learn. It's not about saying there's one way to do this. It's about trying different approaches and seeing what works best. And it's the integration of the old and the new. So this was found to be a really helpful model for looking at the role of the associates. And I won't talk through all of this, there's quite a lot here, but in each of these phases, the evaluators identified the role that the creative health associates played in doing that. So within the incumbent system, they were able to at least see what was already happening. So they established the roles within the ICBs, and then they were able to map what was already going on in the current system. A really important role for them was this naming, and this was about raising awareness of creative health across the sectors. They put together resources that named this work as creative health, that demonstrated what it was, what was happening, and inspired people to explore different pathways. And that's it's quite interesting, because that can feel quite passive when you're in that. You sort of feel like, what progress are we making here? We're just talking about the things that are already there, but actually it's a crucial part of systems change is to name and understand that work. This is where a lot of their work was happening in connecting, and this, I say, relevant to this webinar. You know, their role was really about building those relationships with people and then looking for the connections between those individuals or organisations, and not just across sector, but within sector. So the health sector, and I can say as someone who's worked in that for a long time, you know, it's quite siloed in itself. So you have different departments who don't necessarily communicate with each other. And one of the things that the associates role did was to bring those different bits of the sector together, as well as bringing them into contact with other sectors, such as the creative and cultural sector and the wider voluntary and community sector. So they did a lot of that connecting work, convening events, fostering dialogue across sectors, and really building that sense of shared purpose. I've mentioned the huddles. There are other initiatives as well, which were sort of piloted, sort of demonstrating what's possible, what could be possible in the future. And very much also looking at experiential learning, bringing creative health into things like staff away days and staff training. There may be only small elements of that, but just showing them what's possible within that. I've already said that they were very thoughtful about this work, this recognition that actually change is not easy for everyone, and can be quite painful. And so they were really thoughtful about not junking sort of what was going on already, but actually working with that and adding to that with creative health approaches. And instead of forcing change, instead of getting frustrated about that, just trying to create the conditions in which transformation can happen. And again, it was helpful for the associates to understand that this is a really important part of their work, and not to get frustrated at how slow sometimes things can be, but instead recognise the value that they're bringing. And then this bridging role of linking old and new systems through these conversations. Things like placements for trainees from university, for example, again, schemes which were set up as part of the programme, which will continue, and very much acting as these connectors and translators between sectors. And as you might imagine, the emerging system is still emerging, so there's less activity in these areas. But we have seen some new structures and strategies beginning to form as part of this new emerging system, and supporting the people who are champions for this work was a key role for the associates, and one that we're continuing to support. And clearly, the system of influence and illuminating, they've started to do some of that, but the system is itself emerging. So there is less activity at the moment in this area, but it's important to recognise that this is what we're looking to do, showcase those emerging practices. How do we look at scaling up or spreading the impact of this work? So that was found to be really useful it's been found to be really useful within the sector as a way of thinking about this type of work, this systems change. The other model that the evaluators used was this iceberg model, which again looks at it's looking at what's below the surface. It's focusing on the sort of hidden dynamics and trying to make those visible. So that top layer of systems change, we have things like policies and practices and resources, and those are the things that we can make very explicit. We can say, oh, we've now got 6 policies that talk about creative health, and that's great, and that's really valuable. But that is at a very sort of top level of change. And if we move down the levels, what we're actually really needing to do is to work at these deeper levels. So thinking about the relationships and connections and the power dynamics, and then most importantly, the mindsets that either help or hinder transformation or change. So there's a need to work at all levels, is really what the evaluation was saying. So we need to work at that top layer, but we need to be thinking about those other layers. And again, this was something that the associates were doing, and it's really looking at what are the reasons for resistance. Why are people not embracing this? And it does take time. So there's some key findings here. The roles are highly impactful but challenging. Naming and connecting are absolutely critical to embedding creative health. We identified population health and public health as areas of work that could be really promising for future integration with creative health. Cross-sector learning and co-production as key, and leadership development, infrastructure investment important, and this whole thing about system stewardship really essential. I'm going to hand back to Alex now to talk about where we go with this next.
Thanks. Thanks, Jane. So towards the end of the programme, we worked with a health communications specialist to develop our communications work, and we're continuing to do that. We're delivering targeted communications to that health and care audience in the form of newsletters, webinars, and further resources. And we developed a new part of the website, which is particularly focused on health and care professionals and contains resources to help them implement creative health in practice through short guides, videos, and case studies. As Jane has been describing, systems thinking provided the framework for the evaluation, and we're very enthusiastic about continuing to learn about systems thinking and how it can help with our aims to embed creative health. This aligns with the Integrated Care Board blueprint for the new structure that's coming, that the government has published, which emphasises the importance of systems thinking knowledge and skills in their workforce. We believe this approach can help with a shared language for bridging between the worlds of health and culture. Our Creative Health Champions Network is for leaders and decision makers within health and care systems who have the influence and ability to connect, share ideas, and celebrate what is working well. There are currently over 100 champions in 38 out of the 42 integrated care systems in England, and they're a valuable network for our ongoing work to embed creative health in systems. We're currently developing plans for a next phase, which will, if we can secure funding, support more creative health roles across England. At this time, when there is huge change and restructuring of those systems, we need to be able to be agile and adaptable and embrace uncertainty and seize opportunities. One of the most recent announcements is for the 43 first phase neighbourhood health areas, which are in areas they say the services will target working class areas with lowest life expectancy and longest waits to tackle the nation's stark and unjust health inequalities. So I think that's a good point to end, because we're going to move into an example from the Mobilising Community Assets to Tackle Health Inequalities programme and Arts for Us. But I think first we may have time for some questions. It's not quite 11 o'clock, Helen. I haven't quite been keeping track.
That's brilliant. Thank you so much to Alex and Jane from the NCCH. That was really fascinating. And we do have a question in Q&A. A reminder to our audience to please, if you have questions, post them in Q&A. And an apology to our attendees who have struggled to join. There's clearly a tech issue with the link. So we hope that other people may be joining once we've resolved those tech issues. But I've got a question for Alex and Jane from Ellie. Thank you to Ellie for your question. Ellie says, it's great to see such impact from the Creative Health Associate posts. You say the programme led to the development of new programmes. Can you give specific examples of this and how the Creative Health roles facilitated this?
Shall I come in on that, Alex? Yeah, so one of the examples is around stroke rehabilitation. And it's taken quite a long time, but it's down in the southeast, and one of the hospitals down there, the associate, met up with the stroke rehabilitation lead, clinical lead, and initially they've got a new stroke rehabilitation unit down there, and they were talking about improving the environment. So looking at, you know, art on the walls, that sort of approach was where the clinical lead was coming from. But through her work and through her conversations, when the clinical lead, Esther, our associate down there, was able to describe to her other ways in which creativity can be brought into that rehabilitation service in the form of activities, not just about improving the environment. So it's started off. We're not through that programme yet, you know, but it's the beginning of that. But it's again one of those examples where that conversation with somebody who's already interested but hadn't really thought about the broader aspects of creative health, you know, can sort of influence that programme. So there is work continuing down there to build creative health into that stroke rehab programme. I think the other area I would say is the Huddles work in northeast London, which brought Cardboard Citizens Theatre Company into a space with people with lived experience of homelessness and clinical colleagues who were looking at their health services for homeless people. So there was a redesign of the service, but as importantly, is a commitment to continuing that a way of working, of bringing creative practitioners in to work with people with lived experience to continue to develop those services. So it was an example of how a model of working was taken up by the ICB. And we have others where creative health has been mentioned in, for example, de-prescribing strategy in the Northeast. We've yet to see that translating into a detailed programme, but it's there in their plans. So yeah, a couple of examples there.
That's brilliant. Thank you, Jane. We've got a couple of other questions for you. From Joanne. Thanks, Joanne. Joanne says, you mentioned changes to funding, etc. What does that mean for creatives already delivering creative health projects in the areas you mentioned?
Jane, I don't know whether it was you that mentioned funding changes. I mean, funding is like the fundamental problem and barrier and challenge for everyone trying to develop this work at whatever level in the system. We have been doing some work on that. We've had a student, in fact, with the masters at UCL working on commissioning, which built on a commission for some work on commissioning to the North of England Commissioning Support Unit. So I'm not sure whether the question refers to a specific problem. Jane, did you mention funding particularly?
No, I'm not quite clear what it refers to either. I mean, yeah, sorry, I need a bit more information to answer that question.
Maybe, Joanne, you could put a bit more, what was it exactly that you heard?
Joanne, if you don't mind posting an extension to your question. Meanwhile, we've got another question from Maya. Maya, I hope I pronounced your name right. As part of composting, you mentioned the importance of creating the right conditions for change that is not forced. What are your top tips for this? Good question.
Jane, I'll let you elaborate, but I would just say that a sort of co-produced approach and not a obviously confrontational approach. And I think that evaluation process is all about how you work with people and support change and recognize the value of people who are wedded to the old because it's where they're used to and they're secure, and that change is difficult for everyone. So in a sense, a creative health approach is about understanding that people are finding uncertainty and change difficult, and that we can, through creativity, can support that transformation. But Jane, you might have other answer.
I think the key thing for the associates was to do a lot of listening rather than going in and talking and saying, here we are, we can bring all these solutions to you. It was listening to what people were saying, listening to the challenges that were facing them, and then offering opportunities for creative health rather than saying, oh, I've got the answer for this. It was around saying, yeah, I'm hearing what you're saying, you know, here are some examples of where this has helped in other areas, for example. So listening, I think, is really important, and really respecting the challenges that are faced within the sector. It's really easy, I think, for us sitting outside of the health sector, and I've been guilty of this as well, to get really frustrated with the slow pace of change within the sector, that it appears to us that why aren't they embracing this? It's so obvious, we have all this evidence, you know, what's the challenge? And actually listening and understanding what is the day-to-day that people are working and what are the pressures that they're working under, and then coming up with how can this help them with that, rather than this is a new thing that you've got to do. I think is really key. So listening, I think, is really, really important.
That's really helpful. Thank you, Jane and Alex. And Joanne, if you do want to follow up, please do post another question in the chat. Oh, thank you, Joanne. Joanne says, you mentioned the government strategy and said something about funding being a challenge. I'm working in the co-produced creative health space for cancer screening.
Yeah, well, I'd just go back to what I said before, which is that funding is a challenge. As we know, everyone thinks they haven't got much money or any money, but we do find that where this work takes hold inside, then actually funding can be found. I mentioned change. I mean, there's huge changes going on in the health service, but I mentioned the neighbourhood health programme. They have got money for being in the first phase, which I think is 43 of them. But, you know, that requires creative health organisations at a neighbourhood level to be integrated into the conversation. So there's a load of work to be done. In cancer services particularly, I mean, it'd be interesting to hear more about it, Joanne, but probably not the opportunity for that now. But interesting to hear what your situation is. Well, how embedded are you? Are you working within cancer services to understand that better? So do email us about it.
Thanks very much for that, Alex and Jane. And we will be sending out the NCCH info at email address, as well as our Arts for Us email address. So attendees will be able to contact our organisations who are presenting today. We've got one more question before I move us over to Arts for Us, and it's from Claire. Claire said, you mentioned workplace wellbeing. Are there any initiatives that were found to be most receptive within healthcare?
So it's again quite interesting and quite challenging in some places. So yes, I would say that things like choirs singing together is so one of our associates, there was a big staff away day for the whole ICB, looking at the values and approaches for the ICB for them to work together on those priorities. And as part of that, Elaine brought in a number of sort of creative health interventions during the day, one of which was some communal singing together. Another was about doing some making together. And they were really highly valued by the staff there, and people sort of feeling like, oh, this is something that we would really like to do more of. But I would say that the counter to that was also, there was also at a time when resources were really under strain and staff were under strain, it was really important that this wasn't just tokenistic. And so it had to be shown, and not sort of superficial, sort of, oh, we're having a lovely time singing, but tomorrow we get back to the sort of awfulness of trying to make all these savings and deliver all this work for less money. So it was quite a delicate sort of balance, a bit of a tightrope she was walking with that, in terms of, this is what's possible, but I'm not undermining the seriousness of the work that you're, you know, the things that you're dealing with, and this is not just a panacea for this. So there are a lot of and another associates in the East, again, a social prescribing day for staff, did an activity with staff there that was, again, a making activity that was about their own well-being and some ideas about things that they could do for themselves in their working day in a short period of time. But I would say that none of them really got into a deep programme of workforce wellbeing, and I think that is a real challenge for the NHS. There's a lot of talk in the NHS about this, but I think everywhere you go, you'll find people feeling that there's a bit of lip service paid to it.
Thank you for that. Hope that answers your question, Claire. And just a point from Angela, who says, my understanding is that the new neighbourhood health areas don't have specific funding at present, but are being supported through a coaching and development programme. So it would be great to hear more about that. That's perhaps a topic we can look into, and I'm sure will be a big part of making contact with those new neighbourhood health centres that as they're emerging. So thank you for that. So without further ado, a huge thank you to Alex and Jane from NCCH, and I'm going to move us on to our next presentation, which is from the Arts for Us team based at Edge Hill University. And I'm very, very pleased to welcome Vicky Karku, who is going to be presenting and starting your presentation. Over to you, Vicky.
Thank you. Thanks, Helen. Let me take a minute to try to share my screen. And hopefully you are able to see that. Helen, I cannot hear you. Are you able to see?
We can see it, Vicky, but you're in your presenter mode as opposed to interpreter mode for the audience. So I don't know if you just stop sharing and reshare as a presentation. So we could see your next slide.
Is this working or is this the same?
That's it. Lovely.
Great. Okay. So hi, everyone. I'm Vicky Karku. I'm a professor of arts and well-being at Edge Hill University. And I am a director, Research Center for Arts and Well-being, where the Arts for Us project falls under. It has received funding from the Mobilising Community Assets call, and supported by Arts and Humanities Research Council. And not only, I'm going to talk about the role of creative health associates in this project as a good follow-up from what Alex and Jane presented so far. This role has been specifically designed for addressing health inequalities that we already talked about, the mental health priorities that ICBs have, and specifically children's mental health. So that's the focus of the project. I'll say a bit about what we have done so far and hand over to Creative Health Associates for a little first-hand experience of how it is to be part of this project and what people do. So the project is all about creating connections and creating a community and collaborating with other organizations. And more specifically, we're trying to answer a series of research questions. We're trying to find how to access arts activities that best support the mental health of children and young people, how to evaluate these arts activities, and to, when we know what is good practice, to maximize the benefits of arts activities for as many children and young people as possible. It's a 3-year project, so we already have gone through year 1, and we are in the tried to address the first question of the project, and we did a lot of mapping. We synthesized evidence. We looked at children and young people's preferences and barriers and facilitators of access, and we're developing a digital strand in this work as well. And we're due to evaluate the arts activities and develop a scaling up model for this client population, as well as test this learning wider. Young arts for us are in the center of the work. So we have children and young people who are consulting our co-researchers in the project. And if I manage to get, this is our logo that has been animated by young people and turned into a song and an audiovisual enhancement. So you're getting a bit of a taste of all the different strands that come in and offer a holding hands and containment for the work. That's the idea of the logo. There's a wide research team. These are only a few of our colleagues in the research team in the Northwest. There are a number of collaborators. We have co-investigators and partners from a lot from the Northwest, but also nationally and internationally. And we have a Creative Health Associates. And these key roles and people located in different parts of the West and nationally that act as bridges. That's probably the connecting. Their role is very much a connecting role between the research team and the community health, school, and other sort of organizations that we're working with. And I'll say a bit more about them. We work Creative Health Associates have been selected because they had relevant qualifications, skills, and experiences. So they come from an arts education, have an arts education background and some arts practice. All of our Creative Health Associates were recruited on the basis of mental health training that they had before they joined the project. They had experience of working with children and young people, and most had research training. And if those who didn't have specific research training to the needs of the project, they received additional research training. So a lot of the heavy lifting, if you look at the image there, in terms of qualifications, skills, and experiences, took place before they were recruited in the role of Creative Health Associate. So that's one strand of the work. They were also selected because they had good networking skills. They had an understanding of the sector, a clear ethical stance, and capacity to engage with the work reflectively. So these are some of the attributes of our Creative Health Associates. And they were allocated roles and responsibilities. Some of the roles are to build relationships within the host organizations, and this is already named by Alex and Jane earlier, connecting with services and organizations across sectors, offering creative health, creative therapy support and insights. A large number of the creative health associates come with arts therapist qualifications or creative therapy qualifications behind them. And they have done a lot of facilitating groups and collecting research data. So these were some of the roles that have been allocated. Some examples here, there was a lot around relationship building in host organizations. Here is an example from Ludus Dance, one of our co-investigators, and the work Matthew did there, one of our creative health associates in the Light Up Lancaster Festival, where he, with his musical skills, he brought in sound effects and sound tracks that supported the dance performance. This is a picture from working in Kendal, I think, or South Cumbria, where we have the facilitated groups and collected data. So we have a team here of the local community, as well as research assistants and creative health associates, all working in one for one purpose. And there's a lot of engagement of young Arts for Us panel. Here is an example of animated material that was used to train the young Arts for Us panel in research methods. Research training, which I'll play an animation that has no sound now. But this is material that has been produced by creative health associates in collaboration with our research assistants, and that has made me extremely jealous on wanting to retrain as a researcher again, because this is much more exciting training than anything I have received when I was training in research methods. So that's that. There is a lot around engagement, engaging young people and their families. So these are some of the year one activities that involved engaging young people and their families in workshops and focus groups. And these are some of the numbers we have secured so far, and the different types of organizations that have been involved. They have facilitated workshops. A lot of that, the contribution has been on creative engagement with young people and their families, in art making activities, movement, music making processes, and drama, creative writing. So these are things that they helped with active engagement and participation. And they're also supporting and learning how to advance their own research skills and collecting and analyzing data, some of whom have more skills than others, but they become an interesting and creative engagement with their data as well. We talked about connecting with service and organizations. There has been really, that's probably the most active and present role throughout the first year of their engagement in the project. We have met over 50 stakeholders, and we realize there's a lot of knowledge that can come from frontline staff. So we're currently collecting data through a questionnaire and focus groups, targeting 385 participants. We have a QR code. If anybody works with young people, please complete the questionnaire as well. Our creative health associates are going from organization to organization as well, talking about the project and seeing what are the views of frontline staff that can be used as part of, can be capitalized and turned into data. So I'm going to hand over now to a community-based creative health associates. We have 4 community-based creative health associates and 2 health-based creative health associates. So Miriam, if you say a few words about your role and where you come from.
Yes, hi everyone. I'm Miriam. I'm a creative health associate on the project. I'm based in Liverpool with Everton in the Community and Liverpool Learning Partnership, both of which are community projects in Liverpool. So my highlights from year 1 have been working with a group of neurodiverse young people in Everton in the Community, offering creative workshops with them. Working with Liverpool Learning Partnership to deliver story sacks for refugee families, and delivering workshops with Everton and Liverpool Lighthouse, which was a really dynamic and lively experience of working with young people, and they really engaged very well. Thank you.
Thank you, Miriam. So Matthew, tell us a bit about your background and what you're doing as part of your Creative Health Associate role.
Hi everyone, my name is Matthew. My background is working in youth work and sort of facilitating arts and music projects with young people. I currently work for the NHS. I work for Greater Manchester Mental Health as a wellbeing practitioner, and I'm also part of the Arts for Us team as a creative health associate. I'm based in Lancashire and South Cumbria, working with Ludus Dance and More Music in Morecambe. So as Vicky was saying earlier, here is an example of one of my highlights. So this was working at the Lights Up Lancaster Festival. I was working with the dance artists and local young people to come up with a performance. So this happened for numerous nights, and I was working with them to develop the music for that. So kind of piecing together all the different tracks and adding sort of sound effects. I also worked with More Music in Morecambe. So this is where we did a workshop and focus group with some of the young people. They're a large sort of music organisation, and that was a great experience to kind of meet the young people and to get their feedback on how they access the arts. And the last point was February, where we basically did a workshop with some young people on the Young Arts for Us panel. So they're young people that kind of co-produce the research that we work on. And I was fortunate enough to do a little music activity with them. And that's where we came up with the kind of logo that you've seen at the beginning, where we did the stop motion and we added the music. So very proud of that piece. So yeah, I'd like to hand over now.
And Saz?
Thanks, Vicky. Hi, I'm Saz. Yeah, so my background is in drama and community arts. And then from there, I went on to train as a creative psychotherapist at Edge Hill. And I'm now in private practice alongside my work as a community health associate. So my community host organisations, co-investigators are Odd Arts, who are based in Manchester, and the Poetry Society in London, because there's an element of our work that's also going to be national. And my focus in year 1 has been getting to know my host organisations, the young people, the parents, the carers, make new connections, and as Matthew was saying, facilitate the Arts for Us workshops. So a couple of my highlights were going down to London to attend the Poetry Society's Foyle Young Poets of the Year Award and hearing the 10 winning poems from young people. There were over 2,000 entries from across the world to that competition, so it was amazing to be there. I've also been working with Odd. So Odd run a Wellbeing Your Way programme that supports people experiencing mental health challenges through creativity. And we've been looking at how they can expand that to work with 9 to 15-year-olds. And then, yeah, just really been enjoying as well the delivery of the Arts for Us workshop and collecting that data. Thank you.
Wonderful. New projects as part of the contribution Creative Health Associates have done. Nicola?
Hi, I'm Nicola. I come from a photography background and I am a trained art therapist as well. I am in kind of like the Lancashire, South Cumbria area, but I sometimes do Liverpool, so I'm a little bit able to move around sometimes where I'm needed. I have had some really lovely experiences on the project so far. I've really enjoyed them. So some of my highlights have been I've been able to work with Liverpool Lighthouse with the recruitment for the workshops, and I've been able to experience the kind of passion that the quickness in action that is done by some of these community organisations. I was blown away by Liverpool Lighthouse and their help with recruiting, their relationships with the young people, and really, really learned a lot from that experience. I've really enjoyed engaging with the Arts Centre, which is in Skelmersdale and Up Holland, and I was able to kind of form relationships with the young people a little bit through being involved in the audition processes for some of the plays, and then able to attend and watch their performances. And I loved 12th Night, which was about just before Christmas. And that allows me, when they're involved in the project, to have a good relationship with them, to know them, and to have like something to connect over. So I've really enjoyed that. And I've really enjoyed working with the Young Arts for Us group that are helping with the research, that have been collaborating with us and co-creating with us, and kind of working on training materials, ways to make it more engaging for them, and to do the training with them has been wonderful as well. Thank you.
Thank you. And we're moving to health-based creative health associates, and Anna.
Good morning to everyone. So my name is Anna, and my background is social science, primarily in youth studies and social work with children and young people. I was also trained in trade. My host organization is Lancashire and South Cumbria Foundation Trust, where I work very closely with Dr. Kat Taylor in CAMS in Lancaster, who has a very extensive experience and very engaged with promoting a creative health initiative in NHS setting. So we work together, not only recruiting research participants and facilitated art workshops, we also have been mapping opportunities for art activities in NHS setting, and network for promoting these opportunities, so which can be challenging in NHS, but also very exciting. So thank you. This is from me.
Thank you, Anna. Puisi?
Hi everyone, I'm delighted to be here this morning. So my background is psychology and music therapy, and I also have years of experience involving in different arts and health research, including clinical trials. And so I have also worked in a health setting in Ireland before joining this project. So I also understand the difficulty that earlier Alex and Jane has experienced about, convincing the management team, delivering the ideas of importance of arts. And so with my role in the AHRC project, I'm based in the Cheshire and Merseyside ICB, and we hope to deliver the message of the importance of arts in terms of particularly in benefiting the mental health of children and young people, how it can improve the overall surface, and how children and young people can be better support overall. So my role is based in Mercy Care with Dr. Ashish Kumar as my the co-investigator of this project. So I'm based in the the eating disorders team, and also work with the CAMS team, connect with the mental health support team in school and other allied health profession. I've also joined the Creative Therapies Professional Forum of Mercy Care to connect all the people, not just art therapists, but different healthcare professionals with a background in creative therapies. So it's really opened my eyes that how many people actually work in different roles with the background in art therapy training. And so with this forum, we are thinking to really map all the activities, arts activities, all the personnel with the background in creative therapies in the trust, and ideally maybe extended to the whole Northwest to understand how creative arts can support the system. And in the last year, we have delivered, along with my colleague, we have delivered the workshop in 4 different trusts, and particularly in Alderhay, we deliver the workshop at Sunflower House for the inpatients with eating disorder in Alderhay's Hospital, and we also deliver this with camps in MCA. So this is a picture of the workshop. Additionally, we have also connected with the Youth Forum and the Chameleon group in Alderhay. They are the advisory panel of children, young people that are advising on different aspects of the health service. So these are my highlights. I'm handing it back to Vicky.
Thank you. Thanks. Just to you see how much is happening in 1 year only. The Creative Health Associates will, for year 2, will be making an active input in the Wall Cafe that we are organizing, bringing together different stakeholders from different sectors, and we'll be thinking about how to scale up arts initiatives for children and young people. So that's the task, one of the tasks, and they will also make a contribution to our case studies, in-depth, making in-depth descriptions of arts initiatives and organizations. So these are the plans. From year 1, I would like to finish, if I can, with a video from a very small footage from the end of year event, where Creative Health Associates had a very active role throughout, as you can probably see in the footage, and we celebrated a lot of what we have achieved during that first year. You'll see some familiar faces, as in Helen was there. We had people from the World Health Organization, from social prescribing, and a lot of youth presence who moderated keynote speakers and were very active in all aspects of the day. So I'll finish with that. Today we had the end of year event of the first year of the project. Really exciting to be able to share what we have produced so far. We have a young Arts for Us panel guiding the day.
Arts for Us is the largest programme funded in the UK, looking at how the arts and art therapies can support children's mental health.
We're really pleased that Arts for Us is funded under this programme for the second time, funded under phase 1, and now we're in phase 3.
Today is about co-produced research. It's about working with stakeholders, children, young people, policymakers.
We're in it together. We are stronger and louder together. We can't do this alone.
Creating pathways for more young people to be involved in high quality art experiences.
It's really important to have young people's voices embedded within this project because it allows us to understand what their priorities are.
How do we give them hope? How do we give them permission to use their imagination, to take charge and imagine a world that they can then create, that they want to live in and pass down to their children?
Art should be accessible independently of the context, independently of the years in which it is published.
Hearing young people's voices allows us to respond directly to what they need and what they want, essentially.
I joined the team because I personally struggle with my mental health. I found that performing helped me and gave me a way to cope.
I am a young Arts for Us member. I joined the team because I supported the idea of the project.
The arts and humour will not cure illness or misfortune, but they help you curate that life.
I definitely recommend this because it's a way to sort of be more mindful as well, and also what's out there to explore and express.
You should join in at the next event. It's a lot of fun.
Brilliant. Thank you so much to Vicky and the whole Arts for Us team. That was a really inspirational way for us to end our talks for this morning. So thank you to all of you. So we now have plenty of time for questions. I can see we've already got one question in the chat. Thanks, Elle, who says great video. It was a really great video. Just a reminder that we're going to be able to share the recording from today and the contact details for NCCH and for Arts for Us with that recording. So you will get to engage in this. And once again, apologies to our folks who've had trouble joining us. So we're getting our first questions in. Thanks to Helen for your question. I'm going to read that out now. And if I can invite our panelists to think about what the best way to respond is in terms of these questions, and who would want to volunteer and do that by turning your camera on, that would be great. So Helen says, my reflection of these last few presentations show me how much established arts and culture organisations enable this work. Definitely. Some of these organisations I worked for 23 years ago in Liverpool, straight out of uni, doing the same stuff. So many practitioners go round and round phases of research and funding and stay consistent in neighbourhoods. I think this will be the strength of the neighbourhood NHS approach, working with long-established organisations. The fact the North West has well-established arts and creative organisations is a big strength for this work. And here's a question from Helen. Do you see this pattern over time? And do practitioners reflect this? And further, is there animosity there or welcome arms? Really good question and reflections. Thank you to Helen. So Vicky and the team, do you want to respond to Helen's question?
I can have a go. As part of the Arts for Us project, we made an active put an active effort there on making sure that the organizations we had involved vary in terms of longevity of operation as well as size. So we have Tate is involved, the Philharmonic, some big organizations in terms of local and national reach, but we also have organizations that are quite small. Ludus and More Dance are smaller organizations, so we varied them in terms of what would be the type of organization we are involved in, because we felt that different types of organizations brought different things in the picture. What on the whole, our experience is extremely positive, and I don't know whether some of the creative health associates will want to come in on this. The people are really keen to connect. They're really trusting and willing and able to come together. We have these cross-sectional meetings on a monthly basis, where we have the NHS staff with community organizations and cultural organizations. Often there is a sort of communication issue that needs to be addressed because the language might be different, but they're committed and present and there. So I'm left always with a hopeful message at the end of these meetings.
Thanks, Vicky. Does anybody else? I can see that Miriam's got her camera on. Does anybody else want to respond to that?
Yes, so just to add to that, I think overall the response has been really positive. But I think as the first presentation stated, that is actually being a good listener and listening to some of the challenges that the grassroots organisations are facing in terms of funding. So I think that kind of empathy and listening to meeting people where they are and working alongside, not doing to, is really important in this role, to encourage those collaborations.
It's really helpful. Thank you. And Matthew?
Yeah, definitely. I just wanted to add to that question really about there's obviously well-established organisations, community arts organisations that we work with in different areas. Some of them in cities that have been working decades really in the field, and we're obviously working closely with them and supporting them. But there's also like sort of grassroots organisations that work and very embedded in local communities as well. Just thinking about the Gregson in Lancaster, and then also we work with some more rural settings. So in Kendal, we work with an organisation called Kendal Windows on Art, and they have some challenges, but of a different kind, really, just because there's not as much access to different arts provision. They themselves don't actually have a space, but they work a lot with schools in order to sort of develop and work with a sort of local network of community artists. So I think I'm learning through that experience, and that's going to hopefully inform the research as well.
It's really helpful, thank you. And please do keep posting your questions in the Q&A function. But I've got a question, I guess, for all of you, really, especially for those of you that are creative health associates. And it seems like we know that it's such a huge ecosystem, that communities, creative health sector, and this role that you're providing of being that bridging role and being those connectors. I wonder, just particularly I'm thinking for those community organisations that are looking to engage with health, I wonder if you guys who are doing that connecting role have got thoughts and ideas about what is the best way for maintaining those relationships and ways for those community organisations to connect through, for example, you guys, and if you've developed systems and ways of doing that that you found effective. So I don't know if anybody wants to have a go at that. Nicola, go for it. Thank you.
It's been, obviously it's different with each organisation and each creative health associate because of our experiences that we bring. I find, because I come from a youth work background, I'm able to connect really well with like the youth-based organisations because I've worked in them myself, and so a lot of rapport comes from the fact that you are almost peers within that and within the work as well. You're not a researcher that has not actually experienced the fast-paced kind of thing that happens when you're in working with the young people on the front line kind of thing. And so there's a rapport that comes from being a peer, I think. And also, I think a way that helps keep the connection is to just be interested and involved and have fun with the organisation. So a really exciting part of the role has been the opportunity to go and be involved in events that the organisations are doing, to celebrate things with them, and not to only go to them when we want something, but to also celebrate what they're doing and have those conversations with them. And the connection doing that way is kept better because I think research can be very slow for those that are used to working in a very fast-paced environment, especially reactively with young people. And so it keeps the security of like, okay, the research is still happening, and you can ask little questions like, okay, well, what's going on? And it bridges that space between the research and the organizations without having to fall on the researchers all the time, who are trying to do quite a lot already and who may not be experienced in working in those organizations and understand what it feels like. So it's kind of like a mix of things that I found work personally.
It's really helpful. Thanks, Nicola. And Saz.
Hi, yeah. So I would just add to that there are some really great networks out there. So if you're an artist or an arts organisation wanting to get involved in this field of work, I think finding out what networks are in your region. So I know, and it seems to be there's quite a lot happening at the moment around creating network. I think that might partly be, I think we were talking about there's not necessarily a lot of funding around at the moment, but there is a lot of interest and there are a lot of people wanting to connect and there are a lot of people wanting to share practice. So, for example, in Greater Manchester, 42nd Street had just set up a community of practice. There's the Myriad Network, which is for global majority arts in health professionals. And, you know, even networks like LSEPs, local cultural education partnerships, that bring people together who work creatively with young people in schools. So I think, yeah, just being as plugged in as you can be, and because creative health feels like it is really high on the agenda for a lot of those networks at the moment.
Yeah, that's really helpful. Thanks, Saz. And yeah, being aware of those networks, we know there's a lot of interest in keeping those going, and the Culture, Health and Wellbeing Alliance also have both national and regional groups, don't they, around arts and health, creative health. That's really helpful, thank you. And it really showcases the importance of having connector roles like you guys, and the importance of funding that supportive system for keeping that network and that connection going through that ecosystem to make it effective to link with health. Well, sticking with the idea of networking, we've got a question from Carrie, who noted that the work is primarily, it's actually in the Northwest, and can see on the Art for Us site that the associated people are largely based in that area. And Carrie asks, have you found barriers to engagement in sign up in London South and South East? And I wonder if that is actually better directed to the National Centre for Creative Health, because Carrie, Arts for Us is predominantly Northwest, although I think you do have some of your creative health associates, Vicky, that have more of a national remit, but it's actually the National Centre for Creative Health that had the regional posts. So maybe Vicky and Alex might want to come in to address Carrie's point about London and the South.
Yeah, just very briefly to say that it's better directed to Alex as a question, because yes, we are primarily based in Northwest, although SAS, we just spoke, is also having a sort of national reach at the moment. We have London and Poetry Society included. We are planning in year 3 to go outside the Northwest more actively and engage wider. But we have developed, you know, year 1 of our research component identified barriers and facilitators of engagement in the arts and accessing the arts. These are primarily Northwest barriers and facilitators, but I think they are translatable across. I'm going to pause there just to give Alex, who has a more national picture, time to respond.
Thanks. I can't switch on my video, but maybe Melis can. Okay. Hi. Yes, so our creative health associates were in each of the NHS regions, and London is one NHS region, and the South East is another, the Southwest is another. So 3 of our associates were in those 3 areas. And yes, if we can, we would like to expand the programme and have a next phase, but we can't really say much more about that at the moment. But yes, we have the intention to have more associates across England.
Thanks, Alex, and please do keep us posted. Jane.
Should I just add to that in terms of the sort of where the barriers are? I don't think it's less around the regions. For us, it was working within the NHS, it's around the systems. So within each of those regions, you had systems that were really embracing of these roles, and you had other systems that were not quite so ready to do that. And I think that's you know, that's the case sort of across the country. I wouldn't say that it's a particular region is more difficult than another. It's about the systems in those regions and the challenges that they're facing. But in all of the regions, we had systems that were, you know, incredibly receptive and supportive of this work. So yeah, if we're able to expand it, then we would hope to see them across England.
Thank you. Thanks, Jane. I wanted to just bring us back. Angela had posed a question earlier when we were talking about funding, and of course that is such a major topic for us in this area, around that opportunities around neighbourhood health. And whilst we understand that they do have funding allocated, and some of you might be aware that each of those sites that have been named do have funding attached, but which is advertised as 10 million across those sites. But I think maybe Jane, Alex, do you want to just give a little bit more intel on that topic that you are able to share? and I guess what you think in terms of what that potential might be and what the routes in might be for practitioners, organisations around that, if there are any.
Yeah, so just we know from the announcement, but you don't get much detail, that there's 10 million across 43 sites. But I'll hand over to Jane because she has direct experience of Cornwall. She knows about what's going on there, and she can talk in a bit more detail about one of the sites.
Yeah, so I think you're right. The 10 million is, once it's divided up, it's sort of, just over 200,000 per sort of area, and it's likely to be there to support the sort of programme development in that area rather than be for delivery, I think, but we haven't got the detail of that. But what I do know is that in terms of when they're putting in their proposals to become one of these first sort of implementation sites, the areas had to say, what resources were they going to allocate to delivery, because everyone knows it needs funding to deliver this. So in Cornwall, and I don't know how much of this is public, but in Cornwall, I know that the ICB has allocated significant funding to the development of integrated neighbourhoods and in terms of the delivery as well. So I would imagine that would be one of the things that, when these sites were selected, that they would be looking at. And there will definitely be an expectation that resources are allocated to delivery and delivery in a different way. So they were asked to do that and to specify the specific resources that were going into that. So it might not be lots of additional money from government, but there is an expectation that the money that is in the system is used in a different way to deliver differently.
That's really helpful, Jane. Thank you. And is your sense, for example, that the best routes in for that will be, for example, neighbourhood health teams? Is there any sense yet of who will hold those budgets within the ICBs?
So the government, what they have said around this is that the government are saying they have got very clear values and principles underlying the development of the neighbourhood health service, and they have very clear outcomes, but they're not specifying how it is done. So it will be for individual areas, and that will be different in different places. So in Cornwall, for example, the neighbourhood development programme is being handled within the community and mental health trust. So the personnel associated with that have moved from the ICB into the trust. That's for various reasons. In other places, it could be a provider trust, it could be an acute trust that's managing that, it could be the ICB. There's been a call for primary care networks to get together to do this. So I think it will be different in different places. We need to sort of watch this space really, which makes it very difficult for all the rest outside of it, because it's never consistent. But it is about, what works in a local area, what's best for that context, I suppose.
Yeah, that's really helpful. And I think that point you make about the landscape being very different across ICBs, across regions, is really pertinent. And again, argues for how much we need to advocate for these creative health associate connector roles who can be tuned into wherever those opportunities are dispersed across that health ecosystem. And certainly what we are finding from the Mobilising Community Assets programme, from working with projects like Arts for Us that have a very good connection within the ICBs, within the trusts, within PCNs, that really having an understanding of who those units are, how they're dispersed, devolved, having good connections with neighbourhood health teams, with population health teams, with the public health teams, that's really crucial. And again, that's really hard for individual providers to have those connections, isn't it? Whereas the creative health associates, that is your role. So it really goes to show the value of these sorts of connecting roles.
And I think just also to add to that, the connectivity with the wider voluntary community and social enterprise sector is really important, because a lot of, if funding is going into non-clinical services from the NHS, a lot of the time it is going through voluntary sector infrastructure organisations, and sometimes, in lots of places, the creative and cultural sector is not part of those. So I think that's really important. It's really difficult for them because of capacity, but I think it's really important that the creative and cultural sectors start to understand that relationship and how they could be part of that.
That's a really helpful way to end. Thank you so much, Jane, that point of those voluntary community, faith, social enterprise sector bodies that often get those commissions, and understanding who those commissions are and what your relationship could be with them. And again, a lot of that learning is coming out of those Mobilising Community Assets programme, of the importance of having those connections with those organisations who might do very different work, say like citizen advice, for example, or drug and alcohol support services. So we're running rapidly out of time. A huge thank you to all of our speakers and presenters. A huge thank you to Sarah and Paul, our BSL interpreters, and many apologies to those of you who've had technical difficulties at joining us today. We have recorded today's session and we will be making that available on the NCCH National Centre for Creative Health website. It will also be mailed to everybody who's signed up to the webinar, and we'll be sending you the contact details for the NCCH and for Arts for Us. So I hope you've enjoyed today's session, and it's been lovely to hear from all of you about the great work that you're doing around connecting creative health. Thanks to everybody and goodbye.